How can an organization implement an initiative and ensure it has real impact, not just potential impact? Some scale up and try implementing all on their own. In the case of the Bridge to Benefits initiative, a program implemented by the Children's Defense Fund, they would need to work with and through community partners if their initiative were going to be successful. This abridged video of the Bridge to Benefits e-case illustrates how an innovative program can be implemented within a network to build capacity and add public value. The full Hubert Project e-case takes you through the process of developing the Bridge to Benefits initiative, including how they form partnerships and networks across the states, how they evolved the tool itself, and how they made the work sustainable. To begin, let's learn a little bit more about how Bridge to Benefits began in Minnesota. CDF began a project to help families figure out if their child was eligible for public health care coverage. This work stemmed from their Leave No Child Behind mission in ensuring every child a healthy start, a head start, a fair start, a safe start, and a moral start in life and successful passage to adulthood with the help of caring families and communities. Soon, CDF realized they needed to expand the tool beyond healthcare coverage to all public support programs. Thus, Bridge to Benefits was born, an online tool that screens and helps families apply to a number of public support programs, as Elaine Cunningham explains.
Try to make it as easy as we can for the families to find out about and access those programs that they're eligible for. We do that through the Bridge to Benefits website, which again is available for anyone, but we work mostly through community-based organizations. When the family or when an organization working with a family comes to the site, they run them through the quick screening tool. It'll let them know which programs they're potentially eligible for, and it will also let them know the benefit amount that they might be eligible for. Then it provides applications on the site. You can download an application from the site. But we also include information on community-based organizations that will help you fill out that application. We know that complicated applications is one of the big reasons why families are unsuccessful in enrolling in programs. What we try to do is link them with an organization that's going to sit down with them on a one-to-one basis or do it over the phone and let them know how to complete the process. So if you are being screened at, say, a food shelf, and you find out you're eligible for health care and you're eligible for food support, that person who's working with you at the food shelf can email your information to an organization that's going to follow up with you and say, can I help you with that application? Somebody's going to follow up with them, and it's all done through the website.
Bridge to Benefits screens families and helps them apply to a number of programs, including assistance for child care, energy, medical, food, and even tax credits. So why is Bridge to Benefits needed? Many children and families are eligible for public support programs, but are not enrolled. Some are unaware of the program. Some don't know that they are eligible. Others are unable to complete the required paperwork and steps to enroll. The statistics are overwhelming. Most shocking is that 82% of families who are eligible for childcare are not currently enrolled, and 70% are not accessing heat and energy assistance. The statistics illustrate the need to bridge the gap between children and families who are eligible for support but are not enrolled. This is where Bridge to Benefits and its community-based organization partners step in. So how does Bridge to Benefits work? Anyone residing in Minnesota, North Dakota, South Dakota, or Montana may go directly to the Bridge to Benefits site and enter their own information to see if they are eligible for any of the public assistance programs. But as Diane Leaders explains, many learn about the tool through a community organization.
It's a very fast and accurate screening tool, so we can use it for people that walk in, walk to our front counter and say, I'd like to know if I qualify for food support or some other program. It's also anonymous, so they don't have to turn over a bunch of paperwork to anyone. We've used the tool in a lot of ways, and I think it's led to increased partnerships and increased networking. For example, in the last year we've done 4 food drops where people can just come and pick up food. No income requirements, no eligibility screening done whatsoever. But we take them aside and then use the Abridged benefits and screen them for food support or energy assistance, like I said. And we find lots of people that have qualified all along but didn't know about it. So yeah, we are using it to work with United Way that puts on the food support things, or the food drops. We're using it with the tax aid programs, and we're using it with the local food shelves. Honestly, it's a really good working tool for what we do. It helps us connect to the community, and helps the community easily connect to us and through us to services.
When CDF first created Bridge to Benefits, they knew many community-based organizations would benefit from providing the tool to the people they serve.
Because the tool is internet-based, I think there is a challenge to populations that don't use computers, aren't comfortable with the internet and websites and things like that. Younger people are much more comfortable going to websites and figuring out whether they're eligible themselves. So I'd say people that aren't computer literate, people that don't have access, which could be lots of low-income people, or senior populations that aren't comfortable with computers and internet and websites in general. So you have to either give them access, which we do at our agency, or you have to get them comfortable moving around themselves on websites and on the internet.
Bridge to Benefits staff and leadership expected an overwhelming response once the tool was launched and showcased at conferences. In reality, it took a concerted outreach effort by CDF to spread the word and the value of the tool. Elaine Cunningham explains how they got the word out.
We did have that feeling like if we just put it out there, presented at a couple of conferences, they would be beating down our doors to use it, and that did not happen. And we really had to go out within the community, and by community I mean the entire state of Minnesota, and really kind of sell, if you will, what this screening tool was going to do for organizations that were trying to help families find services. And they were really surprised actually when we'd say, no, this is a free service for you, there is no fee. You can use the site whenever you want, and be a partner, and not only do you get to use the site, but we actually give you information, we give you applications, we give you handouts, we give you almost everything that you need to be able to help a family. And we track data for you, and we give you that data back. So you can use that data for your own reporting purposes, your own fundraising purposes. So we think that's a value added that we can give back to community organizations as well, to show what they are doing in the ways that they help families. And it's pretty incredible. Added benefit for us as an organization, as a Children's Defense Fund, was that we got to know so many different organizations throughout the state.
Carrie Jo Short of Minnesota Philanthropy Partners, a Bridge to Benefits community partner, explains the strength of working in a network and the appeal of funding the project.
They already have a relationship. There's already a trust that's been built up there. Someone's coming to them saying, okay, I'm working on this issue. I'm trying to make the best choices that I can for myself and my family. And to have a worker say, you know what, let's go through this. There might be other things we haven't thought of, other benefits, other ways that you can benefit your family and bring yourself out of maybe this very low income or poverty level to a more sustainable financial situation.
When we started working with community organizations and realizing how powerful our relationships with them could be, I think it changed internally the way we thought about advocacy. That these organizations that we work with are kind of on-the-ground advocates. I mean, once they start working with these programs and understanding how complicated they are, once they understand how difficult the programs are for families, once they understand that some of them are underfunded, once they understand that some of them may be cut in whatever legislative session that we're coming into, I think it makes them stronger voices than they probably were before they got involved with Bridge to Benefits. Our screening tool has actually had several iterations, and many of the changes that we made were a direct result of what our partners were telling us. We added WIC, for example. We translated the site into Spanish. We added the benefit calculator, and that was all because our partners told us that's what we needed.
While Bridge to Benefits is unique, it is not the only online benefit screening tool, but how the program is implemented differs from other national models. in addition to connecting clients to the program. The program has also helped build partner capacity, strengthen advocacy networks, and added value to community-based organizations and CDF itself. As we conclude this video, reflect on the following. What are the costs and benefits of working alone or in networks? Would the network model used by Bridge to Benefits work in a different context?